So since the 90s, the field's grown pretty largely, would you say?
I would say we've had some hiccups.
Okay.
But the reality is, yes, I believe strongly that the clinical nurse specialist role has begun to grow again. Evidence here at the NACNS conference is that 2 years ago we had 14 CNS student posters that we judged for awards. This year there were 31.
Wow,
So,
that's great.
yes, a significant increase. So we're seeing large numbers of students. We're seeing students engaged in the process of learning. They come from all demographics, and we are thrilled to see them. And I'm just really, really pleased to see the resurgence in the role.
Speaking of the meeting, like what are kind of key hot topics you're seeing in like the sessions, or just kind of, in your conversations with other attendees?
Yeah, well, of course, the hot topic of the day is the Affordable Care Act and how
Right.
that's going to impact healthcare overall. The way that it's going to impact clinical nurse specialists in particular, how do we see the nursing clinical nurse specialists fitting into the role of what ACA is. I have to admit I'm somewhat isolated from the effects of it because I work in the VA system.
Okay.
So within the VA system, we've been, I don't want to say completely, but we are essentially an Affordable Care Act and have been for years, so it's really not a major impact to us.
Yeah.
But what I see happening, and I find it very exciting, is that clinical nurse specialists are expanding and looking at things that they never looked at before. They're moving into primary care. They're moving into areas of transitional care. They're moving into very clearly trying to bring the evidence-based practice to providers and practitioners in all avenues. They're doing those transitional care elements, which would have been called a case manager in the past, but the CNSs are bringing the advanced practice flair to that, which is really, I think, bringing a new sense and flavor to how patients will see their transitions across the acute care, home care, primary care, and back again. So I'm just very excited by the opportunities being presented by these changes in healthcare.
Yeah, so, would you say the Affordable Care Act, we're at this conference 5 years or 10 years from now, would you say that it's going to be the most impactful thing on your profession?
5 or 10 years from now, no.
No,
I don't think so. I think this is an opportunity right now for us to expand and show the worth and value of the clinical nurse specialist. The areas that I think are going to have the greatest impact, though, 5 or 10 years from now, are going to be genetics. And really looking at how does genetics play into the care of complex ill patients. How does the CNS move within the realm of genetics to assist, counsel, provide support for, in terms of the psychosocial elements as well as the systems level issues. Being able to look at that complex care, being able to take a look at the nurse and what their needs are to provide care for that complex care need patient, and for the system within a whole new world of genetics and the implications of that to the practice and care.
Yeah, like mapping the genome and...
Yeah, but there's some exciting stuff that's going on in terms of psychiatric illnesses and being able to identify markers and then being able to really tailor medications to the needs of that patient and their care plan. So really working well in concert with how do we take care of a patient from a genetics perspective and infuse the elements of systems level care, making sure the nursing care is well advanced for the needs of those patients, and then also making sure those patients have everything they need. So again, working within the 3 spheres of influence and pulling together what the CNS can do and can best shine at doing within the system.
That's great. And you personally, are you working on any books coming down the pipeline, or?
Well, of course we are.
Yeah.
We're looking at a 2nd edition of the CNS book.
Great.
We are, in fact, ready to, we've got authors already ready. They're upping their chapters, re-upping. We have added some new chapters. We're going to be looking at case examples for primary care and how the Affordable Care Act has impacted the practice of clinical nurse specialists. So yes, we are working on it. We're hoping that we'll have the book ready for publication by, I'm being hopeful, by next fall.
Oh, that'd be excellent. So, a year, I guess, next meeting, we could talk about it.
Yes, yeah, we can.
Okay. Well, thank you so much, Kelly Goudreau, for your time. And the book is Foundations of Clinical Nurse Specialist Practice.
Thank you.
you.